Hello, this is Bob Tauber. Once again, welcome to part 2 of our first week's video. And I also want to welcome those of you who are in Louise Jansen's class who are watching this video. Just a real quick background that I didn't share in part 1 for my class of my background. I've worked in mental health as a profession for nearly 4 decades. And I started in, believe it or not, a sleep disorders clinic, Stanford Sleep Disorders Clinic. So that was my first area, sleep disorders. And my next job was up in the San Francisco Bay Area working in an acute psychiatric hospital. This was a hospital with 55 beds, mostly an open hospital, not locked, although it also did have a locked unit. It was, again, acute, so it was for people in acute and florid states of mental distress. And it was almost always full, 55 beds, and the average length of stay was somewhere between 2 and 6 weeks. And so that was really where my real learning and challenges was so difficult in mental health came from working those 4 years. During that time, I went back to graduate school and got my master's and got licensed. And then I started working in more of a systems modality with families near the San Jose, Santa Clara area. And so I worked primarily with adolescents, as I did in the psych hospital. Half the time I was with adolescents and half with adults. But once I was licensed, I worked in a family therapy center, and my specialty were families in crisis, mostly because of kids who had run away and were somehow on the streets, usually in the San Jose area. So I did family therapy till about 1980. All this started around 1972. And then I moved to Santa Barbara, and in addition to a private practice, I started working in a center for adults with serious and persistent mental illnesses. And that used to be known, for those of you who know Santa Barbara, as work training programs. It's now called PathPoint. And I spent 10 years there, and by my 10th year, I was the director of all of the mental health services. And after that, I was recruited by UCLA, believe it or not, to run programs to test materials they had developed, but in hospital settings, to test them in an actual community, to see if we could help clients monitor their symptoms so they know when they're having a relapse, stay out of the hospital, have a better quality of life. And I ended up working for UCLA for 16 years, all out of Santa Barbara, believe it or not. So after UCLA, which would have been about 2006, I started working for what was then called the Mental Wellness Center, and now is called, was then called the Mental Health Association, and is now known as the Mental Wellness Center, where some of you may be end up doing traineeships. And I'm still a consultant for the Mental Wellness Center. So one thing that's important to know for those of you in my class and those of you in Louise's class is that there's a population that I've never worked with, and that's young kids. And when I say young, for the most part, 12 years and younger. I've had lots of experience with adolescent populations, lots of experience with adults, experience with substance abuse related issues and eating disorders, and a vast array. Actually, probably I've worked with at least a couple thousand clients, but not with kids. And so for those of you who have worked with kids or are going to be working with kids, you have a broader knowledge than me, and I really encourage you all to share that in this online class, both your knowledge of the working with kids, but your knowledge in general about any of the areas that we're going to be covering. So psychopathology is essentially a class that surveys what are called mental disorders. But before we get to mental disorders, I want to break down some of the components that make up mental disorders and that aren't considered officially a mental disorder. So the question I would ask in a live class at this time is, why do people come in to see psychotherapists? Why would they come in to see you if you're working in the field? Or why would you go in to see others? And usually I get a list of various, I get a lot of different answers, and I'll get things like going through a divorce or dissolution, or sometimes things like trying to adjust to a new job stress. And sometimes people will say things like they go to therapy because they're experiencing panic attacks. Or they might say they're experiencing excessive worry. They might say that they're experiencing depression in one form or another, a low mood, loss of interest in things that used to be interesting. They might say that they recently made a move, or it could be issues of acculturation issues. It could be somebody who moved from another country and is trying to, has acculturation challenges, or I don't know the best word to say, since there's a lot of situations, but just relocation challenges. And so on and so forth. So the thing that I hope if you look at these two lists, you notice there's some difference. I mean, I could continue and expand these lists. But what you'll hear when you ask people, and when you ask yourself, why do people go in for therapy, you usually get a list that, this one, which involves things you'd call more like stressors, or what we'll call it in this class, issues. People have challenging issues that cause them stress in their lives. On the other hand, this column are what we call in psychopathology symptoms. We're not yet calling these mental disorders, because you could have symptoms of, you could have panic attacks and not have a mental disorder. You can have excessive worry and not have a mental disorder. You could have depression and it isn't necessarily a mental disorder. Mental disorders are made up of symptoms that are at a certain degree of severity and meet some other criteria. So a lot of what you're going to be studying in this class are symptoms and how those symptoms come together to create what are mental disorders. You're always looking, of course, at what the stressors are, because for sure the stressors a person is experiencing, their issues feed in to the symptoms. There's no doubt. There's a relationship between these two. But in counseling sessions, there's no doubt also that you'd be teaching communication skills, if it was a marital, spousal stress, and issues are a big focus. But psychopathology is more a focus on symptoms. And symptoms are, some people say issues, there's literally 1,000 issues, but there are far fewer symptoms. Symptoms seem to be more wired into our bodies and seem to be actually, even though they're not exactly precisely the same, but seem to be more universal. If you ask somebody who lives in Mumbai, India, to describe a panic attack using the proper language, you're going to hear heart racing, palms sweating, difficulty breathing. You're going to hear a lot of the same description that you're going to hear in other locations. Whereas the issues in Mumbai, and the issues are just so vast, involving different environments and cultures and different stressors. So that's the point I want to end this second segment of the videotape with, this differentiation between issues and symptoms. And now we're going to go on in the next section and talk about how symptoms shift into mental disorders and a little more material on that. So that's the end of section 2, and we'll be getting to section 3, which will be our last section. Thank you.